Okay, today we're going to talk about one of the most intense emergencies in all of medicine, the tension pneumothorax. Now, this isn't just a simple collapsed lung. Oh no, this is a full-blown crisis happening inside the chest, a true race against pressure where every single second counts. So what makes it so incredibly deadly?
It really all boils down to this one question. How does a problem that starts with a little air in the chest suddenly spiral out of control and threaten to stop the heart itself? That's the puzzle we're going to piece together right now. So how does this whole catastrophe even get started? Well, believe it or not, it all begins with a pretty simple mechanical problem. It's all about air getting into a place it shouldn't be and then not being able to get out.
To really get this, we need a quick look at the anatomy. I want you to imagine your lung is sitting inside a sealed plastic bag. That sealed bag is what's called the pleural space, and normally it's a vacuum, which is what helps your lung inflate and deflate. But what happens if you poke a hole in that bag?
And this right here is the absolute key. An injury to the lung or chest wall can create a kind of tissue flap, one that acts like a one-way valve. So with every breath the person takes, air gets sucked into that pleural space. But when they try to exhale, that little flap seals shut. The air is trapped, and it just starts to build and build and build.
So now you've got all this trapped air, and it immediately kicks off this devastating chain reaction inside the chest. It's like watching dominoes fall, one after another, and each one pushes the patient closer and closer to disaster.
The process is just terrifyingly quick and logical. First, the air is trapped. Then, the pressure inside the chest just skyrockets. That pressure completely crushes the lung on that side, squashing it flat. And finally, the pressure becomes so enormous that it physically shoves your heart, your windpipe, and all the major blood vessels clean over to the other side of your chest.
And here's the twist. You'd think, okay, the collapsed lung is the main problem, right? I mean, not being able to breathe from one lung sounds pretty bad. But that's actually not the thing that's going to kill the patient first.
Nope. The real, immediate, life-threatening emergency is what all that pressure is doing to the heart and those big blood vessels. This is where the race against time really begins.
This is the heart of the matter. Literally. That insane amount of pressure is physically squeezing the vena cavae. Those are the two massive veins that return all the blood from your body back to your heart. Just think of someone standing on a garden hose. The flow is cut off. The heart suddenly has nothing to pump, and blood pressure just plummets. Now, this state has a name. It's called obstructive shock. And it's critical to understand this. The heart itself is working just fine. The pump is okay, but there's a physical blockage, that pressure, that's preventing it from getting any fuel. The body is shutting down simply because blood can't get back to the heart to be circulated. And that's why time is everything here. This isn't some slow decline. With every single breath that person takes, more air gets trapped, the pressure gets higher, and that deadly spiral towards cardiac arrest just gets faster and faster. So, okay, if the problem is a massive buildup of pressure, what's the solution? Well, it's actually pretty direct. You have to release that pressure. And you have to do it right now, often before that patient can even dream of getting to a hospital.
And this might be the most crucial insight for anyone responding to this emergency. In that moment, you are not performing lung surgery. Your goal is much simpler and much more urgent. You're performing a life-saving maneuver to get the heart pumping again.
This comparison really makes it clear. When a medic performs a needle decompression, basically poking a large needle into the chest, all that trapped air comes hissing out. Instantly, the pressure is off the heart and blood vessels. The circulation is restored. The obstructive shock is fixed. But notice what it doesn't do. It doesn't fix the hole in the lung. It doesn't fix the source of the leak. All it does is buy the single most precious thing that patient needs: time.
All right, so how do you actually spot this killer in a chaotic real-world situation? Well, there are some key signs that, when you see them together, should be screaming tension pneumothorax. So if you're ever on a scene where someone has had trauma, especially to the chest, and they start to go downhill fast, this combination of symptoms should set off every alarm bell in your head. And here it is. This is the classic diagnostic triad. First, hypotension. Their blood pressure is crashing. Well, that's the obstructive shock we just talked about. Second, they're in severe respiratory distress, fighting for every breath. And third, and this is a big one, you listen to their chest and one side is completely silent. That collapsed lung isn't moving any air. If you see those three things together after a chest injury, you have to act as if it's a tension pneumothorax until you can prove it's not. Which brings us to our final and most critical takeaway. When you think about a tension pneumothorax, I want you to ask yourself this question. While it all starts as a lung problem, it becomes a heart problem, a circulatory problem almost immediately. And understanding that distinction, well, that's the key to knowing why this is such a desperate race against pressure.